Okay, to start with high yield terms to learn. First of all, the acid peptic disease, a group of disorders involving erosions or ulceration of mucosal lining of the gastrointestinal tract, including Gerd, gastric and duodenal ulcers, non-ulcer dyspepsia, and stress-related gastritis. Acid peptic disease. It includes disorders which lead to the erosion, ulceration of mucosa of GIT tract, which includes GERD, gastric and duodenal ulcers, non-ulcer dyspepsia, and stress-related gastritis. Antiemetics, a drug that reduces nausea and vomiting. GERD. What is GERD? GERD is the esophageal irritation and inflammation due to the reflux of stomach acid, known as heartburn. In a layman language, GERD is also known as heartburn. Gastroparesis. The paralysis of the muscles of the stomach and possibly other parts of the GIT tract due to the damage of the gastrointestinal nerves or muscles, common in advanced diabetes and Parkinson's disease, is known as gastroparesis. It occurs in two conditions, Parkinson's disease and in advanced diabetes. Inflammatory bowel disease. Inflammatory bowel disorders. Inflammatory bowel disease. Inflammatory bowel disease include the inflammatory disorders involving the irritation, ulceration of the colon and the rectum. Ulcerative colitis, the colon plus more proximal parts of the GIT tract involved is known as Crohn's disease. If the colon and the rectum is involved, that is known as ulcerative colitis. If the colon and the proximal part of the GIT tract, whether it is your oral mucosa or small intestine involved, then it will be called as Crohn's disease. Irritable bowel syndrome. Irritable bowel syndrome include the disease of unknown origin characterized by the episodes of abdominal discomfort and abnormal bowel function, diarrhea, constipation, or both. The patient has abnormal bowels, like he has episodes of abdominal discomfort, then he has sometimes he has diarrhea, sometimes he has constipation, or sometimes he has both alternating with each other. Prokinetic, a drug which promotes the GIT motility, is known as prokinetic. Proton pump. Proton pump is the parietal cell hydrogen potassium ATPase that uses the energy of ATP to secrete protons into the stomach. Final common target of drug that suppress the acid secretion. Basically, the proton pump is the parietal cells H positive potassium ATPase, a pump which uses ATP and secrete hydrogen ion or proton into the stomach, which ultimately releases the acids. It is the final common target of the drugs which suppresses the acid secretion. First of all, we study the drugs used in the acid peptic diseases. Ulceration and erosion on the lining of the upper portion of the GIT tract are common problems that manifest as gastroesophageal reflux disease. If there is any ulceration or erosion of the lining of the upper portion of the gastrointestinal tract, are common problems that manifest as GERD, gastric and duodenal peptic ulcers, and stress-related mucosal injury. The drugs used in the acid peptic disease reduce intragastric acidity by manipulating systems controlling the acid secretion, promoting the mucosal defense. In case of peptic ulcers, eradicate the bacterium H. pylori, which is detectable in over 80% of the patients with duodenal ulcers. Basically, in acid peptic disease, there is ulceration, erosion in upper part of the GIT tract, which can be manifested as GERD, gastric ulcers, peptic ulcers, duodenal ulcers, or stress-related mucosal injury. The drugs we used are to reduce intragastric acidity by manipulating the acid secretion, controlling the acid secretion, promoting the mucosal defense, increasing the mucus, and decreasing the acid production, and eradicating the bacteria using antibiotics to eradicate the bacteria, which is the H. pylori, and which is also present in 80% of the patients with duodenal ulcers. Now, first class of drug is antacids. So, what are the antacids? Antacids are the weak bases that neutralizes stomach acids by reacting with protons in the lumen of gut and may also stimulate the protective function of the gastric mucosa. Antacids are weak bases. These neutralizes stomach acids. They react with protons in the lumen of the gut and may also stimulate the protective function of the mucosa. When used regularly in large doses, needed to sufficiently raise the stomach pH, antacid reduce the recurrence of the peptic ulcers. If we use antacids regularly, it will reduce peptic ulcers. The antacids differ mainly in their absorption and effects on stool consistency. Some antacids cause constipation, some antacids cause diarrhea. Popular antacids include the magnesium hydroxide, aluminium hydroxide. Neither of these weak bases is significantly absorbed. Neither of these bases is significantly absorbed from the bowel. Magnesium hydroxide has strong laxative effect and aluminium hydroxide has strong constipating effect. These drugs are available as single ingredient product and as combined preparation. Calcium carbonate and sodium bicarbonate are the weak bases, but they differ from aluminium and magnesium hydroxides in being absorbed from the gut. Because their systemic effects, calcium and the bicarbonate salt are less popular as antacids.